Dozens of local nurses leaving their jobs, accusations of poor health care and unsafe conditions.
Now, the Nurses Union and Deaconess Medical Center are telling very different versions of that story.
Spokane's second largest hospital is facing serious allegations tonight from its nurses union.
The union claims staffing levels at Deaconess Medical Center are putting patients at risk, but the hospital says patients are safe and the union is intentionally spreading distortions and inaccuracies.
KXLY4's Erik Loney live in downtown Spokane, where nurses just ended their news conference on this matter. Erik?
Yeah, the union held a press conference here at the Red Lion Inn. It wrapped up about an hour ago. The union says 31 nurses have left Deaconess in the past 2 months over concerns about patient safety. But the hospital says that's news to them. The nurses gave a different reason for leaving during exit interviews. So we had 2 press conferences today with 2 different stories about what's happening at Deaconess Medical Center. Deaconess hospital staff packed a conference room to hear doctors, nurses, and administrators ensure the public that Deaconess is safe.
There is no staffing crisis at Deaconess Hospital.
This hospital, this system, does not have unsafe conditions for patients.
Patient care is safe, and I would send my family here.
This press conference was a preemptive strike to a press conference held 3 hours later by the hospital's nurses union.
This is a healthcare emergency.
The nurses union says recent cuts to nurses' aides and technicians is stretching nurses too thin and putting patients' lives at risk.
The patients are still getting very good care because we're all working very hard to see that they do. But it puts a stress on the nurses, and when we're stressed and in a hurry, sometimes we can make mistakes.
Hospital officials said the union is using Deaconess as an example and spreading distortions and inaccuracies to push a national agenda to create a national standard ratio of 1 nurse to 4 patients in hospitals.
We're not running a campaign. We are practicing our profession in a responsible and dignified way.
Now, even the number of nurses that have left have kind of been a discrepancy. The union said 31, the hospital said 34 in 3 months. So Deaconess says their staffing is comparable to other hospitals in the area, and they are bringing some of those nurses' aides back. The union says they do plan on filing some complaints with the State Department of Health over the staffing issue. Reporting live, Erik Loney, KXLY4.